see in that data and numbers?
If anything, it is time to be more vigilant, not less, in the face of this hope and that.
All right, now we have almost everyone available to us. Thanks for joining us on our media briefing for Wednesday. Hope it's Wednesday. I'd like to start off by introducing our CAO, Charles McKeague, for some brief words, and then we'll get on to our presenters.
Thank you, May. I appreciate it. As the media knows, we've been doing these briefings 3 days a week. I hope that is good timing for everyone. If it's too much or too little, let Maya know. If we don't have a lot of new information, it may be advisable maybe to cut these down to 2 days a week, but I don't want to cut off the media channels that we have to get information out. So please let us know. I think as many people are aware of the messages that I've been trying to send recently is that we need to do our part. The classic slogans that have been out there. We're in this together. All those apply. The one I wanted to touch on a little more today or two messages I wanted to touch on today. One is that we have a lot of hurt in the community in a way, both emotionally and economically, and I guess as well as medically, obviously. The good thing on the medical side, in many ways, is that we're doing a pretty good job here in Monterey County and keeping the numbers low and lower than many of our neighboring jurisdictions, and of course many across the world. Our numbers are definitely better than most other jurisdictions. Whether that's luck, I don't know, or whether it's attributable to some of the early steps that we took. And whether it was luck or the early steps that we took, I think at this point it's incumbent upon us to remain vigilant with the recommendations from the scientists and healthcare professionals, because at this time, we all may have our individual opinions, but we should be following that advice and those recommendations and maintaining strict adherence to the stay-in-place order, the only traveling for essential services, trying to limit your activities and interactions with others, because the more you travel, the evidence shows the more likely that we're going to have the spread. And although many of us can be very vigilant when we go out, and try to avoid touching different surfaces or coming in contact with other people, the inadvertent transmission is more likely the more we have traveled. That you may think that, oh, I'm just going into work and I can do it, even though I could be working from home. The likelihood that someone is going to inadvertently slip up is too significant in this situation, because it may mean somebody's life. It may not be yours, may not be somebody that you know or love, but it may be somebody else in our community, and we want to make sure that every life is protected. That said, on our lineup today is talking about some of the economic hardships. We have Kimberly Craig for the Monterey Bay Business Council, Monterey County Business Council. I can get it. And I think she's going to have some helpful information for us to help the business community here understand their resources. Yeah, another vulnerable population are obviously the animals here, our pets, and some of those pets get lost, and some people are unable to care for them, and some people just don't want to care for them, and that's I guess their choice. And so we have Cindy Burnham from our animal shelter, Animal Control Services, to talk about some of the challenges with our pets and wildlife here in Monterey County, and we appreciate having that talk here today, because it's another vulnerable population. We obviously focus on the people here and the economics, and that's important, but I guess there's some challenges with animals too. And then finally, one of our never-ending stars, Kelsey Scanlon at the Office of Emergency Services. There she is. She gets a lot of information out to us. I don't know if she's worked without sleep for a month or not, but it seems like it. So I appreciate all the work she's doing. With that, I'll turn it back over to Maya and field any questions later on.
Thank you, Charles. I want to check and see if Dr. Moreno is on the line. He had planned to be here, and I'm not seeing his name on the list. So we might give him a few more minutes to get on the line. And then we'll move on for our guest, Kimberly Craig with the Business Council. We're really pleased that you could join us today and talk about some of the relief efforts and an upcoming webinar that a lot of people might be very interested in.
Thank you. So my name's Kimberly Craig. I'm the president and CEO of the Monterey County Business Council, and we realized relatively early on that there was a need for bullet-pointed, simplistic information to be disseminated to small businesses. The legislation was over 800 pages, was overwhelming for a lot of small businesses. So Monterey County Business Council partnered with the Small Business Development Center and the County of Monterey and the City of Salinas to provide weekly webinars, which are 1-hour webinars. They're at 10 a.m. on, you can register on Eventbrite. And ultimately what those webinars are doing is giving updated and quick, simple information. Last week's webinar, we had over 798 small business registrants for our webinar. At the peak, we had over 600 that were actively participating, and we had 282 questions asked within an hour. So understanding and recognizing that we have a real need for information and some guidance, Monterey County Business Council is continuing the partnership and committed to communication with those small businesses. As I mentioned, this upcoming webinar is specifically for the Paycheck Protection Program. We have Cindy Merzon from the Small Business Development Center on the call, as well as Lee Takakawa from Cal Coastal. We are looking to get a couple of bankers as well, trying to make sure that we have those secured before we announce. And then we also have Jorge Riguerin from Santa Cruz County Bank. And uniquely, Santa Cruz County Bank is accepting applications from businesses that they don't have a previous relationship with. As some of you may know, some of the larger banks have capped out at their maximum. Wells Fargo Bank being one of them. I think the application process for PPP, the Paycheck Protection Program, opened on Friday, and as of Saturday afternoon, Wells Fargo Bank had shut down all applications and they had reached their $10 billion limit. And the reason why they have such a low asset cap was because of the 2018 situation where they opened millions of accounts for customers without their permission. So the Federal Reserve issued a lower asset cap. As of about 3 hours ago, there is a consideration to raise that asset cap so that Wells Fargo can continue to accept applications and underwrite emergency small business loans. So that's great news. Additionally, I just received an email from Bank of America. Bank of America has taken a very proactive approach as well. And let me read what they said. We are expanding our process to address the needs of a larger group of small business clients who have a transaction account but do not have a credit or borrowing relationship with us or another bank. So as you can imagine, the information for these loans is changing literally every 12 hours. And so we recognize that that is really important to make sure that we give it to small business owners as quickly as possible and as accurately as possible. And we're doing that through those partnerships so that we are ensuring that correct information is going out across all platforms. That's it. Just one final plug for the webinar on Friday. It is a free webinar. You are welcome to register for it and see what we're doing. The registration is on Eventbrite under MCBC, Monterey County Business Council, and the SBDC, which is Small Business Development Center. With that, I'm happy to take any questions.
All right, thanks, Kimberly. We'll get all of our presenters through the cycle, and then we'll open the floor up for questions. I'd like to turn to Cindy Burnham, our Animal Services Manager. a lot of people have a lot of worries right now, and even for their pets, they're worried. So maybe you can tell us more about what's happening at the shelter and some of the interesting collaborations you're able to do right now.
Hi, good morning. I'm Cindy Burnham, Animal Services Administrator for Salinas and Monterey County. And yes, every week has been interesting and challenging on its own. We've got some great crews here that have been really rallying. I think a lot of people know that we have animals here and not quite understanding initially that there's people behind the animals. And so we've had to do a lot of internal adjustments to keep the animals safe, as well as the folks that are behind the animals. As many of you know, we've been working between the city and the county for, 5 years now, working to consolidate services. When these emergencies hit and each city and Monterey County adjusted services to allow for staffing that needed to stay home, social distancing, working from home, limiting animal intake became our top priority in the event that staffing had to not be at the shelter due to exposure or sickness. We couldn't have a situation where we had shelters full of animals. So we made the call out to our community to help us come clear the shelters essentially. And I think within the first 3 days after the shelter in place was put in, we had over 35 animals in foster care, just from asking our community, our volunteers, folks we knew, hey, who wants to come help us? That call has been continuous. But what that also caused us to look at is, can we do more together, obviously socially distanced? And so we basically the city and the county are now operating under one building, under the county's animal shelter. All animals coming from Salinas, Marina, Monterey County, and jurisdictions are being housed here at our county facility. Right now, I think as of this morning, we had 13 dogs and 1 cat. So we are continuing to get animals in. They're still getting lost. We've had 2 dogs reclaimed by their owners yesterday. So we are still getting folks coming to look for their animals. We're doing it, a lot of it online, by the phone, to confirm ownership. And then as animals that are able to be up for adoption, we're reaching out to those fosters that are still coming to us, and we're placing them in foster care. So we've had to adjust a lot. We are not currently providing any surgeries in our spay-neuter clinic. Spay-neuters are not considered an essential surgery at this time. And so we are getting things ramped up. So when we are able to start doing surgeries, all those animals coming back from foster homes will be spayed and neutered and then ultimately adopted. I'm pretty sure there's a lot of foster failures out there that will be keeping the animals that they have. To run through some of the changes that we instituted with our shared sheltering system, we are asking residents at this time that if they find a cat and it is not sick or injured, or have other circumstances that require us to have it here, to leave it be. A lot of times community cats are cats that are roaming the neighborhood. They have people feeding them. They have a place to go. It is not an emergency where it needs to come into the shelter. So we are asking people to leave the cats be at this time. Same thing with kittens. This is unfortunately the start of what we call kitten season. But we find a lot of people are very quick to swoop up little kittens as they find them. But we really want the public to know that to kind of slow that a little bit, find out if a mother cat will come back before you just grab the kittens. And we want mama to be there to take care of the kittens and not utilize the resources that we have that are very limited. We do have foster homes and rescues there if we need them for those kittens that really can't be raised by their mother cat. For stray dogs, we are here for stray dogs. We have asked the public to help us find the owners before they bring to the shelter, because a lot of times it's 3 houses down or it's across the street. And with a little, due diligence and a lot of social media, a lot of times pets can be reunited with their owners where they don't have to come to the shelter. If that's not the case, we are here for stray dogs in Salinas or Monterey County. If you're able to house it temporarily, we do ask that you let us know. because we will post it on our website, we're sharing them on our social media so that while you may not have the opportunity to walk through the building, you can see every animal that we've got, and those that report it to us, which we can't stress enough. If you find an animal, please report it to us so that the owner does have an opportunity to claim it. We'll get that message out there. If you do find that your pet is here at the shelter, just give us a call. We'll coordinate getting it back to you. Not a problem. We are just not having the public walk into the shelters right now. It just became very difficult to maintain social distancing. As I mentioned, we do have animal control officers in the public, or out in the public patrolling 5 days a week, so that they're able to respond to bite case quarantines, aggressive injured animals, stray animals that can't be housed, that require a pickup. We are there. Let's see, we have unfortunately, because we're not doing spay neuter surgeries, put a pause on our community cat or shelter neuter return program for feral cats. Unless they're sick or injured, now's not the time to be trapping cats and getting them fixed. We will be ready to get that rolling as soon as we're able to start doing surgeries again. If the public is interested in fostering animals, we do have a specific form on our website on the county's page for that with some questions. It immediately gets transmitted to our foster care coordinator, and we can get you on the list if you're interested in helping us foster. As far as dog licensing programs, you can send that in via mail at this point for the county. For Salinas, you can go to salinasanimals.com, and we're running through those programs. We don't have staff on site to be assisting customers with licensing at this time. Both shelters, we're working hard. We've got staff here 7 days a week taking care of the animals. They're getting out, they're getting toys and Kongs and enrichment. Our volunteer program is on pause because we're just, again, back to social limiting and asking people to stay home. We're taking care of those animals, so I want people to know that that's still happening. We're still here every day, and we're doing what we can. We also do communicate on a regular basis with the SPCA, and we're talking to each other in the event that supplies are needed or questions come up, or hey, what are you doing about this? We're trying to all keep each other in the loop on that. That's all I've got.
Thank you very much, Cindy. I'm kind of counting on those foster failures, having had them myself.
Yes, it's an easy thing to fail at.
Thank you. And I see Dr. Moreno has joined us on the call. We really appreciate him being here and to give us an update on public health issues.
So hi, this is Ed Moreno, Dr. Moreno, Health Officer, Monterey County. So I just want to stress that we as a community are still experiencing COVID-19 transmission in our community. I do want to thank everyone who's doing their part to stay at home and only go out to provide or receive essential services. I think the evidence shows that it is having an impact on slowing down the spread of COVID-19, which again is really important for preventing a surge scenario that where the demand for hospital level care exceeds our hospital's ability to provide that care. So that's very important that we continue to stay at home and only go out for essential services. I want to point out that for those that are interested, we've now added to our report of confirmed cases in Monterey County on our website, demographic information that includes race and ethnicity. We met our threshold to be able to break that down among a few categories, but since we just posted it with small numbers, we will need some time to see how the COVID-19 among confirmed cases is dispersed by race and ethnicity. So that information was just recently added on our website. We continue to conduct or interview confirmed cases. We have over 60 cases in Monterey County and 2 deaths to report on. And we also have, I think, over 450 contacts or close contacts to those individuals. So if you look at 63 confirmed cases and 450 close contacts, you can see how many people are exposed to a small number of individuals with known disease. I think that's important because when you realize how many people can be exposed before a person is actually diagnosed, it's I think reflective of how this virus is transmitted, can be transmitted, because we have a lot more contacts than we think we do. So again, it's really important, even in a shelter at home, people are still having more contacts than they think they do. So it really is important to stay at home so that when we call on a person who's been confirmed to have COVID-19, what we're hoping is that they did everything they could to stay home, and the number of people that they expose is small. That's really what we want to see out of our contact investigations. We are also working with our skilled nursing facilities, our long-term care facilities, and helping them to prepare for COVID-19. A lot of our facilities have already have measures in place because they implement infection control measures to prevent outbreaks of influenza or gastroenteritis in their facilities. So some of this is not new, but it is a new virus and it's a pandemic. So they're rightfully concerned, and we are working with them to make sure that they have the most up-to-date guidance, and also that they have trained their staff on proper use of PPE, that they've made the request to purchase PPE, personal protective equipment, and that they've taken measures to prevent their staff from bringing COVID-19 into their facilities as well. And we are also, I'll just mention briefly, we're still working on, we're taking the next steps to have the alternative sites available to make sure that we can isolate people who otherwise can't isolate themselves if they're diagnosed with COVID-19 in Monterey County, so that they don't spread it to others that they are living with. So I'll stop there and hand it back to Maya.
Great, thank you, Dr. Moreno. And then we'd ask Kelsey Scanlon. Hello, Kelsey. We'd like to ask you to tell us a little bit about a project you've had connecting people with volunteer and giving opportunities during this crisis.
Absolutely. So I won't take up too much of your time, and I will share my screen here in a second. We've been getting a lot of questions from the public about how they can contribute. It's actually one of my favorite parts about our communities here in Monterey County is that even under duress, they're always so giving, and they always want to help as much as they can. They're really committed to, the resiliency of their neighbors and all that they've invested in their communities. So really a big shout out to them. I know it's tough and people feel like they're out of control, or that there's so much that's out of their control, and they're looking for ways to, gain a sense of consistency and regularity. And I think donations and volunteers is a really great opportunity to do that. So on the website, we have, let me share my screen real quick. On the website, we have several different opportunities listed. You can donate locally. So we've listed all of the hospitals that are always looking for donations, how you can donate to the Monterey Foundation, the Community Foundation for Monterey County, how you can donate food. So if maybe you overbought toilet paper or food, and you are willing to give some back to the community, the food bank is always taking non-perishable food items. And then you can also donate to local agencies such as SPCA for Monterey County. I know that they're always looking for dog food. And there's a variety of other local agencies listed here for people to give back to. And then if you're looking to volunteer, the Community Builders for Monterey County is doing a matching service for people who are looking to participate, whether it's in feeding or deliveries, stuff like that. And then below down here, you can see all of the links to how you can volunteer for a hospital, or volunteer for Meals on Wheels or Salvation Army or at the food bank. I know that they are always looking for more volunteers, and they've really ramped up their operations and would greatly appreciate anybody who has the time and capability to come support them. They're really serving some of our most vulnerable populations that really are at risk of COVID-19. And then finally, if you don't want to leave your home, which I totally understand, you can volunteer virtually. There are so many opportunities, from research to transcription to peer-to-peer counseling, translation work, blogging, activism. This page goes on for like days, and there's something for everyone. So I highly recommend everyone to take a peek at this webpage. It's on our website under response, donations, and volunteers. And I'll have Maya send out the link as well. And then finally, the one thing I wanted to bring up was that large companies that want to donate can in fact do that, and they can email us at info.oes@co.monterey.ca.us. It's just here on the right-hand side. And I would like to note that if anybody has any intent of sending us fraudulent offers and scams, we will forward them directly to the appropriate authorities. We've gotten a couple of them so far, and it really bogs down the workload essentially. And then for anybody looking to donate money to an organization, if it's not on this list, just be diligent in verifying that it's an actual legitimate agency or person that you're sending money to. There are so many scams out there right now. It's really sad to see actually people taking advantage of the kindness of our communities. So please, like I said, please be very diligent in who you're donating to. So I'm happy to answer questions, but that's all I have.
Thank you very much, Kelsey. So I'm going to open the floor for questions. I have 2 questions that have already come in on chat, and they are for Dr. Moreno. Dr. Moreno, can you please tell us why Latinas appear to be more impacted?
Hi. So thank you for the question. Thank you for looking at our website and looking at the data. So the data is still, we still have small numbers in there. So as time goes on, those percentages will change. I'll give you an example. When we first started to post the data on gender, I believe females were outnumbered the males quite a bit. Now that we have more cases, we're nearly 50-50 on males and females, which is consistent with the state, which is I think like 50.5 and 51% males. So as we get more numbers, the percentages will start to reflect more accurately what we're actually experiencing here. But the point is, I just wanted to make is that as soon as we reach our thresholds, we'll start posting what we can in terms of breaking out confirmed COVID cases by, demographically.
Thank you, Dr. Moreno. And then one more question for you. Are any COVID-19 deaths in nursing homes? Specifically, was there a COVID-19 death at Windsor? The name of the facility, I'm sure.
Sure, so thank you for the question. So at this time, we're still just reporting out deaths from the previous day. We are getting reports in, and when deaths are reported to us, we initiate an investigation to make confirmations before we make anything public. So as with the previous 2 deaths, as we have deaths coming up, we'll continue to follow our protocols. But as soon as we can confirm anything, just like the first 2 deaths, we'll get information out there as soon as possible and work with any impacted. Work with, as we did with the first 2, work with the families, family of the deceased, and then work with anyone else that might be impacted, whether that's a skilled nursing facility or hospital or a work site.
All right, and Dr. Moreno, here's another demographic question. On Friday, you said not all individuals were providing their race or ethnicity. Is that changing? Are you requiring it? What about information from private labs and hospitals?
So we do ask every confirmed case that we interview to provide information on race, ethnicity. If an individual refuses to provide that information, there's not much I can do, but I would say that most of the people who we interview have been providing the information, so I'm not too concerned about that. And what was the second part of the question? I'm sorry, May, what was the other part of that question?
Sorry.
Mary, you're on mute. There you go.
Yeah, I got it. Are you requiring, I'm sorry, what about information from private labs and hospitals?
So thank you. So we are receiving information from private labs, which are considered commercial labs. So all the private and commercial labs and the government labs are complying with the state health officer's order to report all positive and negatives, positive tests, negative tests, inconclusive tests, and quantity not sufficient to me and my health department. So we are receiving those reports, and we're putting those the results on our website. You'll see that just below the demographic information of our cases.
All right, thank you, Dr. Moreno. And I have Kelly Nix from the Pinecone has a question. Go ahead, Kelly.
Hi, thanks. This is for Dr. Moreno. Have you or someone else at the county estimated how many more cases we'll get in the next 2 weeks or a month? And if so, what is that number? And also, at what point will you consider loosening or lifting the shelter-in-place restrictions so people can get back to work?
Okay, so thank you. So we have been looking at models for predicting when a surge will occur. The challenge that we have is, well, I think the good thing that we're experiencing is that because of the shelter-in-place order, we still have cases almost daily, but we haven't seen yet a large, significant increase or exponential increase in the cases. I think we've been able to limit the doubling to not more than 5 days a day, which is an indication of how fast the virus is being transmitted in our community. But I think it is, you have a very good question about the modeling, and with the small numbers on the other side, because we have small numbers, the modeling that we're looking at, which is really intended for communities that have large numbers of cases, doesn't work as well as we would hope it would work. So for planning purposes, we're looking at what we think is going to happen, which is we anticipate that even though the numbers aren't that reliable, we anticipate that the number of, or the demand for hospital beds are going to exceed the number of beds that we actually have in Monterey County. So, what we've done is we are working with our hospitals who are looking at doing everything they can to try to increase the number of beds that or number of patients that they can take care of in and around their facilities. I think the governor was asking that each acute care hospital set a target of trying to increase their bed capacity by 40%. And so each of our hospitals are taking that seriously and are doing what they can, but we could still surpass our capacity. So based on some early modeling and what we think our surge capacity will be, there's still a need, we believe, to prepare for the worst, which would be patients needing hospital level care and the hospitals can't provide it. So how are we going to, in some type of alternative health care site or alternative shelter site or alternative isolation site, provide for those individuals so that if they're not ready to go home, can they still provide some level of care outside of a hospital setting? And let's see, as far as changing the shelter-in-place order, so we here in Monterey County, we are fortunate in that we implemented a shelter-in-place order earlier than other parts of the country. And in fact, I think there are still some states that don't have shelter in place orders. Fortunately, we did that early enough that we've been able to slow down the spread of COVID-19. The concern that I and other public health officials share is that I believe there's some evidence that shows that in some instances when social distancing restrictions were eased up a bit, that the number of cases began to go up again in those communities, not here in the US, but in other countries. And so there's, so I don't have I can't tell you when we would ease up. I can't tell you the specific circumstances or criteria that we would use, that I would use to lessen the restrictions. I think because this is a pandemic and there's some similarities to H1N1, but there's definitely some differences from H1N1, and we're still learning every day as we monitor and measure this pandemic. We learn more about it and how it impacts people and communities. So we'll continue to collect data. We'll continue to work with our healthcare providers and work with the community to try to limit the spread. And we'll see how as we start to see more cases, as we approach a surge in cases in Monterey County, we'll be able to have better estimates of how long it's going to last. One more thing, I'm sorry I'm taking so long to answer, and it's because I don't have a simple answer, but I can describe to you what my thought process is. We will continue to look at parts of the United States like Washington and New York, for example, that are having just tremendous numbers of cases and deaths every day, and learn from their experiences and what worked and what didn't work. And then we look even closer to counties like Santa Clara and some other Bay Area counties, Los Angeles and San Diego County, who have lots of cases, and learn from their experience so that we can take steps as early as possible to avoid that surge on our healthcare system.
All right, thank you, Dr. Moreno. And I have some questions that have come in on chat, and I'm going to take those. With testing still lagging, is there any idea just how widespread the coronavirus actually is in our community?
Oh, yes, thank you. So yes, thank you for that, for acknowledging that we do have a shortage of supplies, particularly the reagents and the test kits in Monterey County, but also throughout the United States. And so so what has not changed is our approach to who gets tested. That hasn't changed since the last time we had a chance to speak. So we are still prioritizing testing among individuals that have symptoms. We're not testing people who don't have symptoms at this time. If people have symptoms and a healthcare provider, particularly those in the emergency departments, feel that someone has COVID-19 and they're going to be admitted to the hospital, that person gets tested. If they're going to go into a congregate living facility like a long-term care facility, or if they're homeless, those people get tested. And we're still testing individuals or prioritizing individuals who identify themselves as healthcare workers and first responders, so that if we find out that they have COVID-19, we can isolate them so that they don't expose other first responders or other healthcare workers. And then the first responding agencies and the hospital facilities can take immediate and appropriate action to make sure that anyone that might have been exposed, they themselves are not in a position to expose anyone else if they come down with COVID-19, and that they know to monitor themselves. So that hasn't changed. We're still prioritizing testing in that manner. Finally, how many people do we think have COVID-19 in Monterey County? I don't have an estimate at this time, but what I do believe is that we have many more than 63 people in Monterey County with COVID-19. And the reason is because we have plenty of evidence to show that individuals who are asymptomatic are somehow transmitting COVID-19 to other people. So, and again, that's based out of, we know that based on the fact that we have community spread, these are people that have COVID-19 that my staff calls, and they tell us they weren't around anyone that was sick. They weren't around anyone that had COVID-19, but they still got sick with COVID-19. They got it from somebody else somehow. So that transmission is happening, which means there are other people out there that we don't know about, that we didn't test, who had COVID-19. So that's why it's important that every one of us assume that COVID-19 is in our city where we live. It's in our communities where we live and where we work. And we have to take measures to avoid people who might be sick. And if we are out, if we need to leave our homes, avoid people that appear sick. And also the state health officer has issued guidance on the use of covering our face if we can't stay at home. As a reminder, if I cover my face and I'm in a meeting with Charles McKeague, I'm covering my face to protect Mr. McKeague in the event that I'm asymptomatic, but I have COVID-19 and I'm infectious. And if Charles McKeague chooses to wear a mask, he's wearing it not to protect himself, but he's wearing it to protect me in the case that he's asymptomatic, but he has COVID-19, he might be infectious. So if we're gonna cover our face, which is fine, keep in mind we're doing it to protect our fellow residents.
Thank you, Dr. Moreno. Here's another question from chat. Are reports of positive cases from commercial testing labs that are doing antibody tests included in county numbers?
So at this time, we're not collecting tests from results from antibody testing, which is also known as serology. At this time, we don't have any CLIA-approved laboratories conducting serology tests on FDA-approved testing equipment. So at this point now, my hope is that we get to a point where we do have CLIA approved, and CLIA is a national standard for approving laboratories to conduct tests that can be relied upon by healthcare providers to make clinical decisions. So my hope is that at some point soon, we'll have CLIA approved laboratories performing a serology test on FDA-approved using FDA-approved equipment. That's the type of test that we can really use for clinical decision-making and also for diagnosing people with COVID-19.
All right, thank you, Dr. Moreno. Here's another question. Are deaths of suspected COVID cases in homes being tested?
Can you ask that question again, please?
Yeah, in fact, maybe the reporter who sent it in could revise the question a little bit. And I'm going to go on to another question. Is there enough PPE? I think this is at Natividad. This may be a question for Natividad. Is there enough PPE at Natividad or other hospitals? And has the county experienced orders being rerouted to federal authorities? And I'm not sure if there's anyone on the call who can answer that, but we can forward that possibly to logistics at OES who might be working on those orders.
Yeah, I think that would be a good idea to get that over to logistics. I think that some of the positives that we have here is our contracts purchasing division, our logistics division, have received significant number of PPE equipment, maybe not everything, but a lot of equipment. And I had, I heard a good response to that question from a registered nurse, director of nursing at a skilled nursing facility. And, she said, yeah, do I have enough equipment right now for today? And yeah, I have enough, but I don't know what tomorrow brings. So I don't know whether I have enough or not. And it's really a difficult question to answer in that regard, because you don't know what the next day brings, or a week from now, or 2 weeks from now, or a month from now. So that's why the question is very difficult at this time.
Right, and then the question that we had that we weren't quite sure about was from Pam Marino, and I'm hoping she's still on the line. If you're on the line, do you want to ask the question directly?
Yeah, I'm here, Maya.
Super. Go ahead.
So yeah, the question is, I know in New York City they're having large numbers of people die at home. I think they were saying 200 a day, whereas opposed to they normally have 20 a day. and those there might be suspected COVID-19, and if they don't get tested, there's no way to include them in the count and thereby get an accurate count of how many people are dying from the virus. So I was just wondering if the county is getting people dying in homes and if those cases are being investigated as potential COVID-19, and then would they be included in the total numbers? Thank you.
Okay, yeah, so Ed Moreno here. So we're not releasing the location of an individual's death in Monterey County. If a person does die in the home, their California statute comes into play. If the individual was under the care of a attending physician in the previous 14 days, that physician can determine the cause of death. If that person was not recently under the care of a physician, it becomes a coroner case. In either situation, either the coroner or the attending physician would need to make a determination as to whether or not, based on interviewing the family or recent care of the patient, whether or not that person had symptoms consistent with COVID-19. In our situation, if we had right now, we would check with the Centers for Disease Control and Prevention, who sent us the test kits, determine up to what point is a test considered reliable if it's conducted on a deceased. If it is, then we could do that, arrange for that. However, unfortunately, what's happening in New York City, they may be at a point that's much different than ours, in which they may or may not have the resources to follow up on individuals who are dying in the home, because they don't have the resource, or it may not be convenient to send staff out to the home. So I think they're at a different place than we are. But for right now, we would work with the attending physician and or the coroner in determining whether or not there's a need to test someone who's recently passed away, who wasn't tested for COVID-19 before they passed away.
Thank you, Dr. Moreno. And here's another question for you. What % of Monterey County residents have been tested? And how does that percentage compare to counties in the Bay Area? Additionally, how do we know Monterey County numbers are low if we're not testing enough people in our population?
So I don't have an answer for that first part of the question. As far as the second part of the question, I'm not saying that the number of people with COVID-19 in Monterey County is low. I'm saying the number of confirmed cases we have in Monterey County is low, and that's because we have limitations on the number of the resources we have to do laboratory testing. So based on the just based on the number of confirmed cases, we use that for modeling. The models right now aren't as reliable as we'd hope, but that's a good thing because you need lots and lots of cases to get good modeling. So we're doing our best with what we have, but I do believe we have many more, probably have, I don't know, we just have a lot more than 63 cases in Monterey County that haven't been tested and been confirmed. Again, the reason is because we have to make sure that we protect our healthcare workers, we protect our first responders, and we protect the healthcare facilities from outbreaks of COVID-19 in those facilities, in skilled nursing facilities and other congregate living facilities. I'm hoping that we, as a nation, are able to find additional test kits and reagents, generate more and provide to locals more test kit and reagents so that we can begin to expand and identify individuals who have milder symptoms and inform them that they have COVID-19 and need to take appropriate action. In the meantime, it's very, very important that people understand that the CDC has provided guidance that applies to everyone. And that guidance is basically guidance on what to do if you think you have COVID-19. That guidance is regardless of whether you're tested for COVID-19 or you didn't get tested, if the person has symptoms that's consistent with COVID-19, the recommendations are the same. That person should isolate themselves from others in their household, so that they don't spread COVID-19 or whatever virus they have to other people in their household. And then they can remove themselves from isolation after if 7 days have passed from onset of their symptoms, and if at least 3 days have passed since the last fever of 100.4 or higher. So assuming that a lot of people out there have COVID-19, people can still take action even though they're not tested, to prevent spread of COVID-19 to other people.
Thank you, Dr. Moreno. And this is a question I think that might be for both OES and you, Dr. Moreno. What is the status on setting up alternative care sites? And has anyone in a congregate living situation tested positive? If so, how and where are they being isolated?
I can start on the first part of that question. We are very far along in working, getting up alternative care sites, and there are different kinds of care sites involved. There are care sites potentially for homeless. There are care sites for persons who I guess have housing vulnerabilities, which may include those that are homeless right now, but also may include persons who are living in different congregate living situations, such as many of our agricultural workers. And then there are also the need for potentially alternative care sites if there were a surge on our hospitals that overwhelmed the hospitals. And so we're looking at a variety of different options with all of those categories, and there may be some other categories that I'm missing at the moment, so that we might have hotels, motels, we might have some smaller spaces and buildings that we put certain, cot type situations that they use, that you may have seen on the news in other areas, and then maybe larger buildings where we could put more beds in those bigger buildings, so that the healthcare workers are able to oversee a larger number of patients at a time if we got to that point. So the plans are moving along. I can't tell you any specifics about any particular locations where they might be up and running or getting or close to be running, because we're not finalized yet. I guess I shouldn't say running because we're not finalized yet, but we are. But we do have the tools available if something were to happen in the short term, and we will be ready if something were to happen longer term, such as a big surge.
All right, and the second part of that question, it's a reasonable question. However, in the course of our case investigation and contact investigations, we identify when the person was infectious and where they were infectious and for what period of time and who they might have exposed. So we do, in the course of case and contact investigations, we do encounter individuals who have spent some time in some type of facility. That could be a business, could be a care facility, it could be an educational facility, just to throw out some examples. If we've identified everyone that was a contact related to that facility and can get to those individuals, then there's no need for us to announce to the public what facility was impacted. If there's a situation where we believe that people were exposed related to the facility, but we can't identify who they were, but we think there's a real risk to a small part of the public who might have been associated with the facility, then we have in the past made announcements publicly, because that's the only way that people would otherwise know that they might have been exposed. We've done that with, an example I'll give you is with tuberculosis. I think we had someone with tuberculosis who was at one of our courts, and we realized a lot of people from the public had been to the courts. And so the only way they would have known is for us to go public, and we have gone public when necessary to inform the public of a risk. If the need comes up, we will announce that, but if the need is not and we can identify the contacts adequately, we would not be announcing whether or not, well, at the location of COVID patients.
Thank you, Dr. Moreno. Here's another question for you. There are complaints of flight schools continuing to give lessons locally. Since there's no way to socially distance in a small plane, should these lessons continue?
So flight schools are not considered an essential service. They're not providing essential service to those of us living in Monterey County. So I have not received any reports from flight schools of them providing that instruction. But I appreciate your letting me know. And if you want to report that as a violation of the health officer order, place to report that would be our hotline, which is 755, area code 831-755-4521. And I'd appreciate it if you called in and let us know. Thank you.
And then I have another question. This might be for OES. Have you determined a location for the FEMA trailers?
You want me to answer that?
Can you?
Yeah, go ahead. I can follow up if you need it.
Yeah, so locations for FEMA trailers are part of the overall strategy to caring and providing sheltering to several cohorts across the Monterey County operational area. Current locations will not be disclosed as they're still currently in progress, but it is part of the overall strategy.
I guess I would also add in there that obviously there are going to be locations that can support those kinds of trailers. So it's not unlimited where we can put trailers, obviously.
Thank you. And then we only have about a minute left before people have to leave at 1 o'clock. Are there any questions out there? Last question.
May I have a question? This is Mark Carbonero with iHeart.
Go ahead.
Okay, one for the doctor and one for Charles McKee. First off, for the doctor, of the people, you're talking about the, I guess, like 63 confirmed cases of COVID-19, 425 contacts. Is every person that was contacted by someone who is confirmed with the COVID-19, is every one of those persons asked to come in or go to a medical facility and be prioritized for testing? That's one. And then the question for Charles McKee, news out of San Jose overnight, there's been some looting with stores broken into. Have you been in touch with Sheriff Burnham about this and any sort of guidance they can provide to local businesses in Monterey County to maybe harden their locations to avoid being looted like that?
Okay, so I'll take the first part of that question. So the contacts are considered individuals that were exposed long enough to the person with COVID-19 that there is a risk of transmission of the virus to that other person. So they're instructed to, we call them, we do our best to get a hold of them. Sometimes we can't get a hold of everyone because we don't get reliable phone numbers or they won't answer the phone. But for the most part, people are responding to our investigation. We instruct them to stay in quarantine as determined based on when they were exposed. And then if they're told to that, first of all, if they don't have any symptoms, then there's no reason to test a person in quarantine. The reason is because if they're halfway through the quarantine and we test them and they're negative, the next day they could come down with symptoms and then they're positive. So testing, we'd have to test the person every day for 14 days if we were to adopt that strategy, and we just can't do that, won't do that. So if someone's asymptomatic, we don't test them. However, they are instructed to call us and let us know if they develop symptoms during their quarantine period suggestive of COVID-19. At that point, if they feel that they need a higher level of care, they can go to emergency department to seek medical care, and the physicians at that point working with us can decide whether or not to test them for COVID-19.
And in answer to your question about looting, I have not been aware of any looting here in Monterey County. I am in regular contact with Sheriff Burnham on a variety of issues. He was just texting me about another issue while we were on this briefing here. And my take on it is that most of that, if it were to occur, is probably going to be occurring in a more urban area, but just my